So now we're going to go ahead and talk about the appendicular section. We talked about the skull, mandible, vertebra, all that stuff. Now what we need to do is talk about all the different limbs. So when we're first starting out, we want to look at the different bones. So your shoulder area is going to be your pectoral girdle. So your pectoral girdle is made of your sternum, your clavicle, and your scapula together. And these things, two things make up your pectoral girdle. These are these bones. Pectoral girdle goes down, fits into your humerus. Humerus fits into this socket like this. Humerus is connected to the two forearm bones, the ulna on the medial side, and the radius on the lateral side. Ulna, radius. Radius has a nice rounded head, broad base. Ulna has the divot. Those are all going to come down and form at the hand. So the hand has its carpal bones, metacarpals, and phalanges. That's the upper limb. Next thing we want to see is the pelvic bones. Pelvic bones, you have two of them. It's called an os coxae. They're there together, and they make up your pelvis like this, with your sacrum in the back. Femur fits into the acetabulum here. So that pelvic bone is made up by ilium, a ischium, and a pubic bone. Ilium, ischium, pubic bone. They'll meet together at the hip socket or the acetabulum. Next, we're going to look at the femur. Femur's big, broad, big head, long shaft, big articulating condyles. Fits in the socket. The femur itself is going to be attached here. So this is going to be my left femur, left tibia, and they articulate there. So your tibia is going to be where the knee joints sit. The condyles of the femur attached to it like this. You have a bending action here. Femur, tibia. On this side you have the fibula. The fibula attaches to the lateral side of the tibia of the shin, very narrow. And this forms your ankle joint, your tibia and your fibula. And they come together to make up your ankle joint. Foot itself is made of big blocky bones, your tarsal bones, your metatarsals and phalanges, proximal, middle, and distal phalanges. Now we're going to go ahead and talk about the hand and the carpal bones. So this is my hand. You'll notice that the fingers are curved. So just like in real life, if you hold your hand by itself, there's naturally going to be a little bit of a flexing of your fingers because you have two big muscles flexing your fingers and only one small muscle extending your fingers. So it takes the natural tension is to curl your fingers because you have two muscles of your forearm flexing them. Same kind of principle is applying to this model. They flex the fingers with springs. So this is going to be that. So your palm is where the flexors are going to be. And you'll notice on your palm, you're going to see these rows of bones. These are going to make up your wrist. So just like in the model, my palm is made of the metacarpals, and my wrist area is going to be with the carpals. My radius actually attaches down and articulates with the hand like this. Most of your wrist is made of the junction between the carpals and that radius. There are 8 bones of the carpal wrist, and they're done in layers of 4. So you have a row distal and a row proximal. So the distal row is by the metacarpals, the proximal row is by the radius. So one way you can determine the names of these bones is by the mnemonic straight line to pinky, here comes the thumb. So the first row starting here by the thumb is the scaphoid, straight. Next bone over is lunate or line. This bone over here is the tritrum or T. And then the bone up here is the pisiform. Straight line to pinky. Scaphoid, lunate, tritrum, pisiform. Straight line to pinky. And you'll notice that's my pinky side. Here's my thumb. Now the next one's going to be, the mnemonic is here comes the thumb. Here comes the thumb. So the H one for here is the hamate. It has an extension here called the hook of the hamate. So just think of the mnemonic that you put, if you're slaughtering a pig, you hang the meat on a hook. So hamate, hook of the hamate. You have a big blocky bone right here, the capitate. A small bone here, the trapezoid. And then this one right here is your trapezium. So here comes the thumb. Hamate, capitate, trapezoid, trapezium. There's a lot of T's, but remember, trapezium is by the thumb. Let's do it again. Straight line to pinky. Here comes the thumb. Scaphoid, lunate, tritrum, pisiform, hamate, capitate, trapezoid, trapezium. Now we're going to talk about the individual features of the bones now that we've done an overview. So this right here was your breastbone, your sternum. The sternum is going to attach to the clavicle. The clavicle has 2 ends, a big, square, blocky end, and a flat, shorter end. So the big, blocky end is the sternal end. It attaches to the manubrium. And then the acromial end attaches to the acromion of the scapula. So acromion end, sternal end. The scapula also has a lot of features to it. When you're trying to identify the scapula, it's important to look for the posterior side. So this is the posterior scapula, and you know it's the posterior by this spine. This is called the spine of the scapula. If you know the spine, you can identify most of the structures right there. So that's my spine. There are several processes. Now remember, a process is a bony extension. So this bony extension is the acromion. And it goes from the spine to here. Above the spine, you see a fossa, supraspinous fossa. Above the spine, here's an infraspinous fossa below the spine. This area right here is your glenoid cavity, where your head of your humerus is going to articulate. So this was my spine, my acromion, and you're going to notice this process right here. This is called the coracoid process. Looks like a bird's beak, where your bicep is going to bind to. So once again, spine of the scapula, acromion, supraspinous fossa, infraspinous fossa, glenoid cavity. On the anterior portion, you're also seeing a nice smooth fossa, and this is where you're going to have the subscapular fossa. That's the scapula. That's going to bind to the humerus. In the humerus here, what you're going to see is a ball and socket joint. So the humerus fits into the glenoid cavity like this. And all the muscles, your supraspinatus, infraspinatus, and subscapularis, or rotator cuff muscles, they all bind to this humerus to hold it in that socket. So this is the head of the humerus. You'll notice between the head you have bony projections here on the lateral side and here on the medial side with a trench or a groove between them. These are where the rotator cuff muscles that hold that shoulder in place attach to. So you have one on the lateral side, the greater tubercle, and one on the medial side, or the lesser tubercle, with the biceps tendon is going to lie between those in the intertubercular groove. Greater tubercle, lesser tubercle, head of the humerus. This right here is the shaft of the humerus, and it's going to be the bulk of that. When you get to the tip of the humerus, this is going to be your elbow. So the elbow itself is where you're going to have the humerus connect to the ulna and the radius. Let's talk about the radius first. So when you get to this end here, you notice you have a nice rounded condyle here. Condyles are where you're going to have attachments. I'm going to call the condyles on the humerus very special names. We're going to call the one on the lateral side the capitulum. It's going to bind to the radial head. So on your hand, humerus, radius, thumb. All of that is lateral. So humerus, radius, thumb. Humerus, radius, and then this is actually backwards, but your thumb would be on this side. That's your capitulum. It rotates like that. So just like with your arm, it rotates. It rotates back and forth. Your radius is going to rotate over top of the ulna, capitulum. The rest of the distal part of the humerus has to do with the hinge joint of the elbow. So your elbow goes back and forth like a door on a hinge, like a hinge on a door. And you have the ulna looks like a crescent wrench. So the ulna has an extension here, a notch, and then an extension towards the end. This is called the olecranon. This is called the trochlear notch, and this is the coronoid process. They fit into grooves onto the humerus. So the groove here that fits into the coronoid process is the coronoid fossa. The rounded section here is your trochlea. And then the fossa that olecranon fits into on the back side of the elbow, that is the olecranon fossa. So once again, that's going to be on the medial side. So here was my shoulder. Medial side of the humerus goes down, fits to the medial side of the ulna. The trochlea is rounded, but it has a sharp edge. So that lets you know that you're in the trochleus, because the trochlea attaches to the ulna, and the ulna is on the medial side of the arm. Next, we want to talk about the lower limb, first starting out with the pelvis. So the pelvis itself is going to be the broad brim area. You have the os coxae, or the hip bones, one on either side, joined together by the sacrum of the axial skeleton. So that makes it this pelvic brim. Your muscles that act in your thigh attach here. Your pelvic diaphragm, where your bladder and things are going to sit, are going to be in this area. When the woman is giving birth, that head of the baby is going to be pushing through the pelvic bone through there. So your bone itself is made of your os coxae. This is on the right side. the os coxae of the left side. Let's look at them separate now. So here's going to be one half of the hip bone. This part of the hip bone where you actually put your hands on your hips, like if you're putting your hands on your hips like this, this is the iliac crest. This right here is your ilium. What you sit on here is called the ischium. So the ischium includes this part of the hip, and this is the part you sit on, the ischiotuberosity. This is what it looks like on the full pelvis. Lastly is going to be the pubic bone. So just like you have a pubic region where your external genitalia are, your pubic bone is going to be over here. So the root of the penis attaches there, parts of the vagina where the minora relates into, that's going to be there. You'll see it on the whole pelvis here. And the pubic bone rests together. You'll notice that you have a hole here made up by the pubic bone and the ischium. This is called the obturator foramen. Part of the nerves that allow you to move your legs inward, adduct them, are innervated by that nerve coming out of that hole. So that's the pelvis. Ischiotuberosity, iliac crest, obturator foramen. Next up, you're going to see the femur. Big, big bone. Big, obvious head. And that head is going to fit into the socket or the acetabulum of the hip, which allows you to bend, flex, adduct, abduct, and rotate all around. Nice ball and socket joint. Just like your humerus had a greater and lesser tubercle that the rotator cuff muscle is attached to, you have equivalent of those on the femur. These are called trochanters, though. You have a greater and a lesser trochanter. And these are going to be where parts of the muscle that allow you to abduct your leg is going to be located, as well as muscle that allows you to adduct your leg. So the muscles from the greater trochanter move your leg outward. Muscles attached to the lesser trochanter bring it in. Big old shaft of the femur. And if you tilt to this side, you're going to see the condyles. Remember, a condyle is a rounded edge, a rounded projection. So you can see those are going to be the femoral condyles with a fossa in between them. Femoral condyles. On the surface, you see a flatted end here, the patellar groove. This is your patella bone, and it slides along that groove as you bend your knee. Prevents friction from there. So your patella, patellar surface, condyles. Then we have the tibia. The tibia attaches to the femur at the knee joint, connected by your anterior and posterior cruciate ligaments and your collateral ligaments. On the lateral side, the fibula does not connect directly to that femur. There are ligaments attaching to it, but it's not directly bony attachment to it like you have with the tibia. The weight does not rest on that tiny fibula. The weight rests on the tibia. So the tibia itself has articulations with the femoral condyles. These are the condyles of the tibia. On this section, you're seeing a bony outgrowth. This is called the tibial tuberosity. Tibial tuberosity is where the patellar tendon attaches to. So the patellar tendon goes from the quadriceps, goes over top and surrounds that patella, and then attaches to the tibia so that you can perform the knee extension. On the distal part of the tibia, you have the medial malleolus. And the medial malleolus is where the ankle is going to attach to. Lateral malleolus is on the other side where the lateral part of the ankle attaches to. Okay. So tibial tuberosity, medial malleolus, fibula. The last thing we want to talk about is going to be the tarsal bones. So just like the carpal bones, they are blocky and they are making up the joints of the foot, but they're larger and they support more of the weight. So when you're looking at a foot, remember when you're arching your foot, your foot arches downward. It's not arches upward. So this is the wrong way to look at the foot. This is the correct way. This is your heel. This is where the tibia connects to the foot. These are your metatarsals and phalanges. So when you're looking here, you see you have a bone connecting from the tarsal to the tibia. This one is your talus. Your heel is the calcaneus. Talus, calcaneus. And then the rest you can see from the top portion. On the big toe side, you see this rounded shape here. This is your navicular bone. Right anterior to that navicular bone, you see these blocky cuneiform bones. Remember, your big toe is going to be medial. So this is my medial, intermediate, and lateral cuneiforms. So big toe is medial, so medial, intermediate, and lateral cuneiforms. And lastly, you see this very large square-like bone by the pinky toe, cuboid. So once again, talus, calcaneus, navicular, medial, intermediate, and lateral cuneiforms, and cuboid. These are going to be making up your metatarsals and phalanges.